So the short answer is hormone therapy is not all the same. And having said that, there are some basic forms and dosages of hormone therapy that are usually appropriate for almost any woman who's in the appropriate age range and does not have a medical history that informs directly on the risks of hormone therapy. And that's, let's say, 75% of women. So there's a basic starting place that really is simple and safe for a large proportion of women who are struggling in their perimenopause and menopause. It can get complicated, just like any other part of medicine, right? If you're a heart doctor and your patient has hypertension, mostly that's a pretty simple and straightforward starting place. But for some people, it isn't at all. And so that's kind of the situation with hormone therapy as well. I think I'll also mention, it's also important, there are non-hormonal treatments for hot flashes and night sweats, for what we call the vasomotor symptoms that are often the most bothersome, that don't involve hormones at all. They have their pluses and minuses. There have been, for decades, we have used a couple of different medicines, what we call off-label, or the more British term would be off-license, which you might recognize. But still, they have a long history of safe use in women who either don't want hormones or can't take hormones because of their specific medical history. Recently, in the past couple of years, there have been now 2 medicines that have been introduced, which are designed specifically to treat menopausal and perimenopausal hot flashes, night sweats, and palpitations. And they are new. They're very promising. They're still quite expensive, as you can imagine, so they're not, a great option for a lot of people yet. But it's really exciting to know that finally, big pharmaceutical companies are recognizing that, from their point of view, from a purely business point of view, this is a giant market of people who really are looking for something. And so there will be more. And soon, hopefully, the ones that have been approved by the FDA and also in the UK will disseminate across the globe and also be available as an alternative to it. To begin with, there is no exact age or number of years that is correct for all women. But I'll tell you what the general guidelines are that most of the large country-based and international menopause organizations adhere to as a general recommendation, which is that you should review with a trusted source, your doctor or whoever has been advising you. You should review with them when you get to the age of 60, or when you've been on hormone therapy for 10 years. It's the right time to review with a knowledgeable person, knowledgeable clinician, the risk and benefit balance of continuing on hormones. The risks of blood clots and to some extent the risks of breast cancer increase more significantly after the age of 60. And so that doesn't mean you should stop when you have your 60th birthday, but it means that because the risks, the sort of population risks are increasing and the benefits are not, it's time to review your individual situation and decide. The other thing that's important is that you can try, right? Because if you're 63 and you just decide you want to try to go off hormone therapy, and you have terrible hot flashes and you can't sleep again, and it disrupts everything, then that's a different risk benefit equation than someone who's 63 and stops taking hormone therapy, and after 2 or 3 months they find that they're not having any hot flashes, and they are sleeping. So it's one of those situations where you can actually do your own personal experiment so that you know in real time what are the risks and what are the benefits that I'm trying to compare.